Welcome to the Community Solutions for Healthy Child Development Grants RFP Information Session webinar. This is the first of 3 information sessions we'll be holding over the coming weeks and the only webinar. Let me introduce myself. I'm Ann Lindy. I work in the Refugee and International Health Program at MDH, and I also work part of my time with the Center for Health Equity. The Center for Health Equity is administering the Community Solutions for Healthy Child Development grants. Here's our agenda for today. We'll provide a bit of background on the Center for Health Equity and how the Community Solutions grants came into existence. Then we'll spend most of our time walking you through key parts of the RFP. We'll also talk about how applications will be reviewed and scored. Here's the link to the Community Solutions RFP webpage. We'll refer to this webpage many times today. This is the place to go for application forms, finding answers to questions, registering for an information or skill building session, and more. Let's move into a brief overview of the MDH Center for Health Equity. Here are a few key people in the Center for Health Equity. Ku Tao, also known as Bruce, is the director, and Sarah Shute is the assistant director. Helen Jackson Lockett-L is one of the leads on the Community Solutions grants. She works with the Community Solutions Advisory Council. You'll hear more about the council in a few minutes. And Helen will oversee the grant application review process. Janelle Munger and Ramya Palaniappan are graduate fellows supporting the Community Solutions grants. Again, I'm Ann Lindy, and I was involved in starting up the Advisory Council and writing the RFP. I'll be the main person responding to questions about the RFP. Darwin is our finance person, and he'll work with grantees on contracts and budgets. The Community Solutions Grant Program embodies the mission of CHE by connecting, strengthening, and amplifying health equity efforts in communities of color and American Indian communities across Minnesota. The grants amplify the work of communities of color and American Indian communities and support them to create their own solutions through investments in their infrastructure, staff, and resources. Through the community of practice, grantees will be connected to a network of statewide leaders doing similar work in their own cultural communities, as well as to the resources, skills, and knowledge of MDH and our partners across the state. Community Solutions grantees are also strengthened through opportunities to enhance their leadership skills, grow their networks, and connect across cultures and programs. Our work in CHE is guided by a set of approaches that you can see in the leaves of this tree, including racial equity, resilience, intersectionality, network leadership, community-driven data and decisions, and systems that heal, not harm. At the same time, our work is rooted in values that we share, including honoring cultural knowledge and wisdom, fostering trust and belonging, listening deeply, and recognizing health equity as a human right. You can learn more about the Center for Health Equity on our website. As you can see here, we have links to a handout and webinar at the bottom of the Community Solutions RFP webpage. Now we'll give a bit of background on how the Community Solutions grants came to be. Community Solutions became a reality thanks to the tireless, visionary advocacy of the Voices and Choices for Children Coalition, the Children's Defense Fund of Minnesota, and many others who championed community-driven approaches to supporting children of color and American Indian children and their families. Voices and Choices aims to bring more voices of people of color and American Indians into policy and decision-making spaces. Their focus is on improving outcomes for children of color and American Indian children in Minnesota through a community and equity-centered approach. Voices and Choices for Children listened to community members around the state who said that they know what works well in their communities and what is needed to address problems, but often lack the resources to make those solutions a reality. Voices and Choices helped create legislation for the Community Solutions Grants to fund those community-led solutions around children's health and development. They envisioned a more equitable process of developing the grant program and awarding and administering the grants. After years of community advocacy, the state legislature passed the Community Solutions Bill and appropriated funding for the grant program in the 2019 legislative session. As part of establishing the grant program, MDH convened the Community Solutions Advisory Council. MDH accepted Advisory Council applications in summer 2019. The application review committee included MDH staff members and community leaders. The council is comprised of 12 members representing diverse Minnesota communities and geographic locations. CSA council members bring professional expertise and lived experience in racial equity, early childhood development, and advocacy. The council co-created this RFP, will serve as grant application reviewers, and will advise MDH on ongoing oversight of the grant program. Council members have expressed determination to keep the community in community solutions. The Council and the MDH team have spoken often about the challenges of working with a state bureaucracy that's steeped in whiteness and, in many cases, hasn't earned the trust of community members. We at MDH truly appreciate the opportunity to co-create this grant program with the Council. Okay, let's get to the heart of our session, which is highlighting key points from the RFP. The purposes of the grant program are to improve child development outcomes related to the well-being of children of color and American Indian children from prenatal to grade 3 and their families. This includes, but is not limited to, the goals outlined by the Minnesota Department of Human Services Early Childhood Systems Reform effort: early learning, health and well-being, economic security, and safe, stable, nurturing relationships and environments. Another purpose of the grant is to reduce racial disparities in children's health and development from prenatal to grade 3. And finally, to promote racial and geographic equity. Here's an overview of the RFP timeline. The last day to submit questions related to the RFP is January 29th. Applications are due February 7th. The top tier of applicants can expect site visits in March. More on that in a bit. Applicants will be notified of funding decisions in April, and grants will begin in May and are projected to run through April 2024. With approximately $750,000 in annual funding, we expect to award between 5 and 10 grants, and we expect that each grantee will be awarded somewhere between $20,000 and $150,000 annually. Eligible applicants include community-based organizations or entities that work with communities of color and American Indian communities and are focused on supporting healthy child development. Tribal nations and tribal organizations are also eligible. Priority will be given to applications from entities led by people of color or American Indians. We're defining this as more than 50% of the board, leadership, and staff are people of color or American Indians, and serving communities of color or American Indians. Entities located in or proposing to serve communities in counties that are moderate to high risk according to the Wilder Research Risk and Reach Report. Entities in counties that have a higher proportion of people of color and or American Indians than the state average. People of color comprise about 21% of Minnesota's population, and American Indians comprise over 1%. Community-based organizations that have historically served communities of color and American Indians and have not traditionally had access to state grant funding. In the scoring criteria, which are Appendix A in the RFP, you can see exactly how we're giving priority to these types of applicants. Proposals must address the needs of children of color and American Indian children from prenatal to grade 3 and their families. Applicants should define the community or communities within this population that they propose to engage and serve. Communities of color include, but are not limited to, Africans, African Americans, Hispanics and Latinos, Asian Americans, and Pacific Islanders. Priority will be given to proposals focused on healthy development from prenatal to age 3, although the eligible population is prenatal through grade 3. Proposals must focus on promoting racial equity and healthy child development and reducing health disparities experienced by children of color and American Indian children from prenatal to grade 3 and their families. Here are some considerations as you develop your proposal. Address the social, economic, and environmental conditions that affect the health of children and families. You can find a link to examples on the RFP webpage. We invite you to think broadly about the conditions that affect the well-being of children and families, perpetuate racial and health inequities, and impact children's health and development. Co-create your proposal with the communities served or impacted, building on community strengths and assets. Build on your own current work. You may include a planning phase of up to 1 year, and please provide support for your proposed approaches. This may include data on the effectiveness of these methods gathered by you or from other sources. Data can include lived experiences, scholarly research, outcomes from past projects, and other sources. Explain why you expect the project to be successful with the communities you're engaging and serving. Applicants are encouraged, but not required, to consider activities and strategies that seek to change policies, systems, environments, and institutions. For example, applicants could propose work to implement or change local, regional, tribal, or state policies related to early learning, programs and services, housing, economic security, families, neighborhoods, and so on. Again, please think broadly about the conditions that affect the health and well-being of children of color and American Indian children from prenatal to grade 3 and their families. Systems. Applicants may seek to change systems that influence the health development and racial equity. For example, systems through which families access housing, transportation, education, and services. Environments. You could propose to change social or physical or built environments to better support healthy child development and racial equity, such as promoting connectedness and stable, nurturing relationships. Or applicants may work to change institutions that, for example, provide education or services to children of color and American Indian children from prenatal to grade 3 and their families. Applicants are welcome to propose other types of activities and strategies, as long as they contribute to improving child development outcomes and reducing health and racial disparities related to the well-being of children of color and American Indian children from prenatal to grade 3 and their families. For example, applicants may propose work that focuses more directly on families. Work with communities often relates to policies, systems, environments, and/or institutions, but applicants may choose to approach their community work in a different way. The graphic shows different broad areas that applicants may choose to work in. Here are some examples of eligible activities, just to get you thinking about possibilities. You could engage community members in policy advocacy, or host a cultural community gathering, or form a community advisory board to recommend changes to an institution. You could form a new partnership between entities. If you run a community-led business, you could create a space for gathering and connections to resources. Or you could do something like involving community members in creating and leading a health education program. There are two main project requirements that applicants must ensure are woven into their project, and the first of these is community engagement and collaboration. Grantees should involve community members in identifying issues, solving problems, and making decisions. Projects should be rooted in and driven by the community. Projects should also be designed to complement and build on other related initiatives in the community. To pursue their project goals, grantees should work together in partnership with relevant stakeholders, which may include community organizations, government agencies, businesses, and others. Community engagement and partnership building should be ongoing throughout the grant period. Evaluation is a required component for several reasons. It helps grantees know if they are making progress toward their goals and see where they can improve their project. It helps MDH report to the state legislature to justify the use of public funds and to show the difference the funds make in the community. It also helps grantees report back to community partners and stakeholders, and helps us all share promising strategies and models with our communities. Grantees may use funds for staff to work on evaluation, or may subcontract with external evaluation partners. MDH will provide technical assistance to grantees in various areas, including evaluation. MDH will also provide for a third-party evaluation capacity building team to support grantees in developing and implementing evaluation plans. The evaluation capacity building team will be led by people of color and American Indians and will have experience providing culturally relevant technical assistance. Let's talk now about the process of applying for a Community Solutions grant. Applicants are strongly encouraged to submit via email. Again, the deadline is February 7th. If you're unable to email, you may submit by mail. You must submit the following for your application to be considered complete: the application form, the work plan, the budget, and the due diligence review form. Part 1 is the application form. It can be found on the RFP webpage. Please submit the application form as a Word document. Don't save it as a PDF. The application form includes sections on general information and applicant organization demographics. You'll write a project summary up to half a page long. You'll answer questions about organizational capacity. Your responses in that section can be up to 15 pages. And you'll answer questions to describe your project. Your responses in the project narrative section can be up to 12 pages. Part 2 is the work plan. Please submit a work plan covering the first 2 years of the grant. That's May 2020 through April 2022. You can find the work plan template on the RFP webpage. Please include all of the information asked for in this template, but you may choose to format your work plan differently. We recognize that a different work plan format may be more suitable for your cultural community. Your work plan can be revised during the grant period in consultation with MDH and the Evaluation Capacity Building team. Please note that while the work plan is just for 2 years, your project narrative in the application form should provide a high-level description of your entire 4-year project. Part 3 is the budget. You'll submit a budget that provides an overview of how funds will be used again during the first 2 years of the grant, May 2020 through April 2022. Applicants are strongly encouraged to use the Excel template provided on the RFP webpage. There are 5 tabs or sheets in that Excel budget template. There are instructions, MDH guidance on indirect costs, the Year 1 budget narrative, and the Year 2 budget narrative. You'll complete those 2 tabs. And then the final tab is the budget summary, which autofills once you complete tabs 3 and 4. You can find detailed instructions on pages 17 through 19 of the RFP. The final component of your application will be the due diligence review form, which asks questions about your organization's capacity and finances. State policy requires that before grant awards are made, MDH conduct a due diligence review of finalists, as well as a review of past performance for applicants who are previous grantees of MDH. These reviews allow MDH to better understand the capacity of applicants and identify opportunities for technical assistance to those that receive grants. A team including the Community Solutions Advisory Council and 1 or 2 MDH employees will review applications. The review committee will score each application on a 300-point scale. We'll take a look at the scoring criteria in a minute. Next, members of the Community Solutions Advisory Council and MDH staff will conduct site visits as part of the application review. The top tier of applicants, based on the scoring of written applications, will receive a site visit in March. The purpose of the site visit is to create a more equitable application review process by giving applicants an additional opportunity to share their work. The review team hopes to get to know applicants and learn more about their work while imposing as little burden as possible on applicants. After scoring applications and conducting site visits, reviewers will meet to discuss the applications. At the end of the meeting, reviewers will make recommendations to MDH as far as which applicants should be funded and at what level. MDH leadership will make the final funding decisions. Again, the review committee will score each application on a 300-point scale. You can see the breakdown of points here. We really do encourage you to review the scoring criteria carefully and score your own application so you can ensure that you're addressing all the key points and creating the strongest application possible. You can find the scoring criteria on pages 27 through 30 of the RFP. As I noted earlier, you can see exactly how we're giving priority to those categories of applicants we talked about. For example, entities led by and serving people of color or American Indians will receive 50 points versus 0 points for those that are not led by and serving people of color or American Indians. In addition to this webinar, we've got 2 in-person information sessions coming up in January. Those sessions will cover the same content as this webinar. We will also be hosting 2 skill building sessions on topics related to grant writing, such as telling your organization's story, developing a work plan, and creating a budget. Those 2 skill building sessions will each cover the same content. You can register on the RFP webpage. If you have any questions, please email them. You can see the email address on this slide or in the RFP. Again, please submit questions by January 29th. And if you're having a problem submitting your question via email, you can call this number. Thank you all so much for joining us today. We hope to see you at one of the skill building sessions in January.